Good morning all. Today I am taking a lecture on role and responsibility of the MLT student. So in the today's lecture we will include the different subtopic that is important for the technicians or the role of the technologist or the technician. So what would be your topics, like what is the introduction of MLT, what are your duties and responsibility as a medical lab technicians, how you can give the comfort and to the patients, your soft behavior and code of the ethics of medical laboratory technicians, grooming techniques of the technicians, and different vaccine against the common infections, precautions of the sample taking while performing the test, and lastly the medical aid and your safety. Okay, so I am starting with what is medical laboratory technology. Medical laboratory or the clinical laboratory is a laboratory where we will perform the clinical pathology test and we will carry out the clinical specimen to obtain the information about the health of the patients. After doing this, we will able to diagnose, that means we will able to diagnose treatment, prevention of the disease. Okay, so 2 or 3 major factor which is a core area for the medical laboratory technologists are to help in the diagnosis, for the help in the treatment and for the prevention of the disease. And medical laboratory technology is a branch of medical science that is responsible for performing laboratory investigations in related to diagnosis, treatment and prevention of the disease. So both definitions are same, means your role is for the diagnosis, to help in the diagnosis to the doctor, and you have to also help for the treatment and for the prevention of the disease. Now what are the units of medical laboratory technology? There are different type of unit of medical laboratory technologies. They are like reception area, hematology area, histopathological area, microbiological areas, serology and immunology area, biochemistry area, virology area, medical genetics, and toxicology area and administrative area. But that means the category of the different medical laboratory, they are categorized into the such type of cell division, which is showing on the your screen. So what is the reception area? Where your sample is collected, where the handling of the sample is done by the person. Okay, next is hematology, the area where the CBC count, your blood film, your coagulation, your ESR, whole the hematological work is performing in that area. Third is histopathological area, where you have to assess for to the doctor for the obtaining the biopsy, for the autopsy and for the cytopathological features. Next area is called microbiological area, where you have to help to the microbiologist we can obtain the different kidney function test, liver function test, FSH, FBG and blood gases. Next branch of the virology that deals with the screening of the viral infection, and we will perform the isolation of the virus, cytopathic effect of the viruses. The important virus for which we are doing the test are hepatitis C virus, hepatitis B virus, torch, etc. The special branch which is also comes in the medical laboratory technology is a medical genetics, in which we will detect the cytogenetics, molecular analysis of different genetic diseases or congenital diseases, that is comes from the mother to offspring. Next is toxicology, that is a study of different type of drugs which comes in the blood, urine, hair, sweat and saliva. And final is the administrative area, where you have to coordinate with the patient and their family member and for the team which is performing their whole work in the different units, to coordinate and cooperate them. That is comes under the administrative and coordinating administration. Okay, so this could be like that. Okay, now in your laboratory the staff can be pathologist of this qualification, clinical biochemist, medical microbiologist, medical laboratory scientist, medical laboratory technologist, medical laboratory assistant and phlebotomist, that is a PVT. Now, what kind of test can be performed in laboratory? That is a general test that is used for the diagnostic of test, are simple test and advanced test. In the simple test, basic principle of the simple test is like hemoglobin, PCV, glucose, bleeding time, clotting time, blood grouping. An advanced test which is used for the advanced principle technique like RIA, FL, ELISA, CLIA, PCR and FISH test. These are the specialized tests. For that special kind of machinery and your perfections are required. Okay. Specificity, sensitivity, availability, cost, complexity, staff qualification, training, accuracy and precious. These are the characters that is different in the simple test or in the advanced test. All the things are low in amount, and the things that are in the simple test, in the advanced test, high, and usually they are the expensive and complex type of things. So this is the difference between the two. Now, what is microscope? Microscope, you can see that microscope is an instrument that is used for the to see the different type of object. They are very much small, you cannot see by the naked eye, so that is called the microscope. And the study of all things by the using of microscopy, that is called the microscopy. And they are of very much different from each other. They are of very much category. Basically the microscope which we are using in the simple performing the simple test or present in the lab, they are the light microscope, that is called the optical microscope. And some specialized area, somewhere there is an electron microscope. Sometime in some advanced lab they will also retain some fluorescent microscope. The difference between the three is that in the simple microscope generally the light beams we are using. In the fluorescent microscope we will use the light of UV light, and electron microscope we will use the electron beam as an illumination of the object. Now, different type of machines and the device which is present in the your lab is, first is incubator, that is a device used to grow and maintain the microbiological culture or the cell culture. Second, incubator that maintains optimum temperature, humidity and carbon dioxide percentage. The temperature that remains within that is 37 degree centigrade. Now, water bath, that is filled with the heated water. We will utilize it for the hot things at various temperature. Next is laboratory oven, used for the different procedure. That temperature varies from 0 to 340 degrees Celsius. That is a centrifuge tube, and we will use for the separation of the different fluid, gas and liquid on the basis of their density. So this is a primary stairs for each and every laboratory, that is a centrifuge. You can see that. Okay. Now electronic balance. Electronic balance is a device that weighs the chemical things to ensure the proper quantity which is useful for the particular type of test. Now, hot plates. For the laboratory setting, hot plates are very much used for the heat glasswares and some things which we want to stir that contains the magnetic stirrer, and something some elements is present in this instrument, so that will provide the proper temperature. Now, machines and the device. Biosafety cabins, that is used for the performing the microbiological work, that is called the microbiological safety cabins, and that is an enclosed ventilated laboratory workplace that is used for the safety working for the professionals. They will not acquire any kind of infections. Okay. Now, that is autoclave. Also, it's very important part that is used for the killing of all unwanted microorganism which is present in the media and other things. We will kill all the organism like bacteria, fungi, spores, etc. The temperature for the autoclave generally which is used for the laboratory purposes 121 degrees centigrade for 15 to 30 minutes. Wax bath, that is useful in the histopathology lab. Okay, that is essentially hot distilled water floating but bath that allows to the meticulous manipulation and location of the section into the glass slide. Okay, this is a this is automated tissue processor in which we will put the tissue in the one component container that will change according to their time to the different area. That is called the automated compact tissue processor. For the complete automatic dehydration, filtration of the human and animal plants tissue to fixing the wax. Spectrophotometer in the biochemical lab, that is a very important instrument that a machine used to measure how much the chemical substances absorb the light. Okay, the basic principle is that compound absorb in the biochemistry lab, that is used to measure the blood sugar, lipid profile test, etc. in the microbiology and determine the bacterial count indirectly. Machines and the device. First is called the tube roller machines. Okay, recommended for the mixing the blood sample, viscous substance and liquid substances where the minimum aeration is required, generally used for the CBC analyzer. Now, automatic analyzer, that is hematological CBT analyzer, that is used for the identification of different type of blood cells at the high speed and with the accuracy. In the CBC report, the result include the RBC count, hemoglobin concentration, HCT, MCV, MCH, MCHC, RDW, WBC count, DLC, platelet count, and PCT, packed cell volume, and MPV. So, these tests is performed in this analyzer. Mini Vidas, that is a greatly appreciated worldwide. That is a very simple and flexible reliability, and that is useful in the 24 hours and 7 availability. It processes the single sample and batch tests for the all type of analysis, serology, immunochemistry, and antigen detection. All the enzyme, immunoassay, pipetting, incubating, washing, reading, and results are sent immediately to the instant printer. That is a Vitek 2 machine, that system that is useful in the microbiology lab. By this we can identify the different type of bacterial species, and that is also useful in the antibiotic susceptibility testing. Next is a gel electrophoresis device that is used to separate the mixture of DNA, RNA or the protein. Gel electrophoresis, the molecule to be separated that is pushed by an electric field through the gel contain the small pore. And micromolecules such as the DNA and RNA and protein, according to their size we can obtain. Okay, that is a PCR machine in which we will perform the PCR test. The method widely used for the making the replicas. The PCR machine or the device is very useful from that area where the sample quantity is very less. So for the rape cases and the criminal cases, so this machine will provide the special a lot of replica for the maintaining the equal required amount of the sample. So this technique is called as PCR mechanism and instrument is called as PCR instrument. Okay. Now ELISA test. ELISA test can be performed in the enzyme linked sorbent assay. That is enzyme linked sorbent assay is ELISA. We will identify by which is peptide, protein, antibiotics and hormone. That is used for the in the biochemistry lab and the medicine lab, mainly biotechnology and machinery. Other biochemistry analyzer, that is a Roche Cabbage 6000 electroimmunosense immunosorbents ISE, electrolytes, absorbance photometry and Biolyzer 200, that is also useful as an automation. The tools and the glassware, you can see that different type of tools and glassware we are using. See, these are the capillary tubes. Okay, these are the special tubes. Okay, these are the syringe, these are the forceps, these are the loop, and these are the cylindrical graduate cylinders. Okay, the instruction inside the lab for the how to behave in the laboratory to the laboratory person. So these are the instruction within the lab. They are the they are as follows. Laboratory usually contain the unsafe substances, so for the attention is required in the lab. So for the both of safety reasons and to avoid the disrupting lab activity, we have to keep the silence of our cell phone, pagers or other things which is causing the distraction. So the all person in the laboratory include the student, staff, visitor, shall wear their safety glasses, goggles, face shield at the time for the potential eye to avoid the potential hazards to the eye. Now instruction inside the lab. Okay, what are the instructions? Eating and drinking chewing gum and applying cosmetics are prohibited in the lab. Do not store the food or beverages in the same refrigerator or freezer. That is very much important. Appropriate gloves are essential when the working with hazardous substances. All gloves materials are not equally effective in the protection, so we have to use the good quality of the gloves. Okay. Now never conduct the unauthorized experiments which is not necessary in lab. Okay, if you have done unintentionally, so you have to first report to your seniors, your manager and your HOD for this unsafe behavior. And we have to use the appropriate clothing. Particularly we have to close toes shoe. Okay, and long pants highly recommended. Avoid the wearing of the best clothes. If you are not hair tie, back and go to the outside of your laboratory and tie up your hairs. Avoid the wearing the different type of dangling jewelries. Okay, wearing an iPod, Bluetooth, any other device that is interface with the hearing is not allowed. And for the pipetting, there is No mouth pipetting is allowed in the lab. All work area must be kept clean. And all chemicals should be labeled, stored in the proper area. Never work alone in the laboratory. At least 1 or 2% should be there. If it is any unhappening is there, so you can you both can help each other. Hazards of the chemical use should not be known. So your flame, your reactivity, stability, toxicity. So material safe data sheet should be there, and you have to follow the same thing. Always pay attention to your surroundings and be aware for other things which is they are doing. Always keep the watch what the others are also doing. Okay, sometimes the accidentally the harm can also occur to you. Next is to remove the contaminated gloves before touching common use, that is door, knob, any other equipments. Before that, discard the gloves before the leaving the laboratory. Okay, always wash the hand and the arm with scalpels and water before leaving the laboratory. No smoking is required in the lab. Now, what is ethic value and what are the you have to do in the laboratory for the better performance or better presence? Like ready, smile, things confident. You should become the confident. You have to have an eye contact to the person who is coming to your lab. Your good posture, your body language and good posture, and excellent grooming, your pleasing personality, your good hygiene, your mingle with everyone, your extra over character, your good communication skill, and your readiness in any situation. So these are your good point that is useful as your good professional worker. You should have all these quality. Now, what is grooming? Although all the time you have a smile, almost 62% and 93% smile are required for the is a part of personal grooming, relation between the personal appearance and image projection to your work area. Appearance, that means you should appear stylishly and improve intelligent and very alert, look like as an appearance. Your appearance should be as an intelligent and the smart. Your perception from people from the some perception that your professionalism, your level of talk, your intelligence and your credibility. About our personal grooming habits, we should overall cleanness of our hair and the body. Our nails should be cut in proper way. Our teeth should be very clean. Our uniform, if it is provided by the lab, we have to wear all that. Their attire should be very good, very attractive, and your makeup should be light. The personal grooming habits, that is our hair should be in the proper way. For the male also, always eyebrow and everything should be in the proper approach, and facial hair should be neat, trim, mustaches, and good appearance is required in the lab as a professional worker. Nail, that should be this type of nail habit should not be there in the lab. You should have a good nails, clean nails without any nail polish. Teeth should be brushed and rinse your mouth after every meal. You have to use uniform. That is a good uniform that is provided by your laboratory. That is of, we can say that at present all your hospitals and labs are tie up with a different multinational company. So your attire and your dress should be, and your ID should be proper. So that's why your approach, your intelligence show by your personality. You should not without any type of accessories, any type of shoes. That is not acceptable at the work area. You should wear the simple flat rubber slippers at that area when you are working within the lab. When you are at the approaching area, that is in the administrative area, or you are at that area where you have to contact with an outsider, so you should in the proper uniform and proper shoe and wear the proper shoes and slippers. Okay, next, these are the hazardous symbols. You should have an idea about the hazardous symbols too. You can see that these are the hazardous symbol, and you should have an idea about all these things that will show that this type of things are remaining there. Now, how you can collect the sample from the general area? We have to completely fill the requisition form, properly label our sample. We have to utilize. We have to take the sample in the leak-proof container. We have to take this adequate volume of the sample. Specimen must be collected at the optimum timing and accurate infective sites. We have to avoid the contamination and commensal flora, and sample should be collected in the local language. Collection before starting the antimicrobial chemotherapy if the person is suffering from the cancer, and proper transportation is required if your lab is very distant from your patient, so you should require some transport media and transport solution for the prevention of any deterioration. Safety of the patient and the medical staff is very much important because they are handling patient and patient's things. Criteria for the rejection of the sample is based on such things which is showing on your screen, that is mismatch identification, the insufficient quantity of your sample, the specimen that is collected is inadequate or proportionate in the container, you are suspecting for the they are the contaminated, and hemolyzed, if the sample is hemolyzed, turbate, and sample has even a lipid content, so you should go for the rejection of the sample. And inappropriate transportation temporary, excessive delay in the transportation, inappropriate transport medium, specimen received in the fixative, dry specimen, leakage specimen, unacceptable specimen sources. This type of requisition form is used. This is one form I have collected from the site internet, that is SMS Medical College, that is of Jaipur. Okay, that is of Government Medical College form, that's why I have taken this type of requisition form is required. You take this requisition from your lab administrator, on which you have to mention the patient name. Simultaneously you have to label the name of the patient or the sample, specimen, the specimen type, unique ID number, that is admission number. Your patient is OPD patient or IPD patient, you have to mention it, the date and time and the place of collection, name and initial of the collector, the sample who have collected, the name of the sample collector should be mentioned here, and their signature should be there. For the biosafety, you have to protect your medical staff for the different things. For the appropriate barrier are required for the very infectious things or very protective, very dangerous things, like you have to provide them personal protective kits or personal protective equipment like disposable gloves, laboratory coat, gown, mask and protective eyewear. For the collection of various specimen, blood culture bottle, we have to provide BD Bactic and Bactic alert. You can see that fluid. For the CSF fluid, for the pleural fluid, for the periodic fluid or ascitic fluid or synovial fluid, we require the universal container, and with anticoagulant we will use for the urine, sterile wide mouth container is used. For the sputum, clean sterile wide mouth disposable container we should use. For the feces, universal container, spoon attached to the inside the screw cap, and volume should be the 1 tablespoon is a 5 ml. This type of swab is also used for the collecting of the sample for the nostril, throat, skin, ear, wounds and other lesions. These cotton wool or the synthetic fibers, and sometimes they are thin wire or the stick. Cotton swabs not preferred to the culture. Okay, Decon and rayon polyester, numerous microscopic folds. Now, the type of the swab is baby swab, paranasal swab, post-nasal size, laryngeal swab, vaginal swabs are used. We have to maintain the quality. If our lab is distant from the our area, so we have to use the transport of the specimen, okay, or guidelines are issued for the transport of the instrument. That is, ideally specimen should be transported in the laboratory as soon as possible. We have collected. In case delay, so we have to use the transport media or the refrigerator for that. Okay. Method of the transportation: primary container we have to dig, then we have to pour into the second container, then tertiary container, then box, then we have to make the hazardous label for that. You can see that if the infection is there, you have to pack like that. Okay. Blood we are using. Lesions, we will collect the sample, we will wipe up the area, then collect the sample, then transport within the 2 hours. Body fluids, we have already mentioned there. You can cerebral spinal fluid. You are not you cannot take the sample of cerebral spinal fluid. You have to take the sample will be taken by the pathologist or other specialized person. You have to just assess them. The container, that is a screw cap tubes which we are using like that. In the ear, we can collect by the swab, that is in middle ear. Eye, the conjunctival sample, style swab we are using. Corneal scraping. Okay, anterior chambers and ventricular chambers, and in the respiratory tract. Okay, oral swab, throat swab, laryngeal swab, nasal swab, nasopharyngeal swab. You can see that from there, nasopharyngeal, from there they are collecting the sample from there. Lower respiratory tract. For the collection of the sputum, first we have to clear our mouth. You have to suggest the patient that please clear the mouth, then breathe in and out in the 3 times, then give the sample to them. Gastric lavage, when some person is taken some poisonous things, or sometime person is suffering from any food poisoning, so this type of gastric lavage is useful. Sinus aspirants, that is also useful. GIT, we will contain the sample from the stool. Container we have mentioned previously in today's lecture. Rectal swab collection, rectal swab. If the any cancer in the gastric area, we will use the gastric biopsy. We will perform the test for the H. pylori to detect its spurious activity. And container is sterile, screw capped, transport, storage. Urinary tract, We can take the sample by the invasive procedure like suprapubic bladder aspiration and urinary catheter. By the non-invasive procedure, we can use the midstream urine and the tapping. You can see that tapping. Before concluding the lecture, just I want to give one thing more, that in today's lecture one thing is very important which is remaining, that is called the first aid. That is, a first aid is a most basic thing, the initial assistance to given the any victim of injury or the illness to overcome or from the situation, or for the reaching the patient or the person to the certain type of hospital or area where the finally help could be managed. So we can say that first aid is a provision of the immediate care to the victim with an injury and the illness usually affected by the layperson and performed within a limited skill range. Generally, first aid is normally performed until the injury illness is satisfactory deal, and first aid is an emergency aid treatment that is given to the someone in the emergency situation before the person is reaches to the regular medical services. Okay, the main objective of the first aid is like prevention for further injury, prevention of the life, and promote the recovery if it is happen. Mainly the primary function is of the first aid is to open the airways, to maintain their breathing and to maintain their circulation, and if it is bleeding is there, so we have to control the bleeding also. The important of the first aid is it should be provided in the quick, by the right person, by the right method, by right knowledge and benefits, and affords affords to the person who is able to perform all these tests smoothly and perfectionly. So this is all about the today's lecture. I hope that you all are able to understand what are the medical laboratory technicians or the technologists, and what are their duties, what are the ethics values, what are the things which is present in the lab, what are the first aid, and how your grooming is there, and how you have to behave in your area. So thank you very much for being with me. Have a nice day.